No?
Okay, nå er det klar.
That was clear. Dear everyone, please continue helping yourself over there. But I think we will start just in order to get this thing to begin. Just to start, I want to say that this is I'm Anne Kveimli. I'm associate professor at the University of Oslo, and we at the university are very happy to co-organize this event with the film festival. It's the second year that we do that kind of collaboration, and we are here to discuss with you, with all of you, and talk about this wonderful film. I would like you to introduce yourself. So I'm also responsible for the teaching in community medicine and social medicine for students at medical school, and I'm working. My field is medical history. So please, but I have a wonderful panel here. So please.
Should I start?
Yeah.
I can start by introducing myself. I am a physician. Infectious specialist working at Ullevål, Oslo University Hospital, and also the professor at the university. And clinically and with research, especially HIV and tuberculosis has been a focus of mine. So that's one of the reasons why it's been so really nice to see this film. And I think I'll come back to that.
Yeah. And Christoph?
Yeah. My name is Christoph Gratman, and I'm a professor in medical history at the same university where these ladies work. And I'm probably here because a lot of my work has been on the recent history of tuberculosis. And that's why it was particularly interesting to watch that film, actually.
So what we plan is that we start, the three of us, to comment a bit on our film very briefly. And then we open the floor for questions or comments or impressions from you, and then we can continue on with the discussion. But Anna-Ma, I would like you to start. What is your immediate, or how did you like the film?
I think it's actually quite a lot of things to comment on. And my immediate reaction is really I'm quite moved by the film because it takes you back to history of 20 years of TB and HIV. And I've been working with both issues for at least last 20 years. And also it's very, watching these young people, they didn't know that they were going to end up as the president of the World Bank or leading physicians. But they started out being very brave, being very ambitious, believing in a moral responsibility and talking against all the dogma and all the establishment. And I think that's such a great inspiration for young people. I teach medical students, and I hope there are some medical students here, because I think that's a very important thing. And the second thing is also that I think for the last few years, this film is even more important than when it was made, because discussing the right to medical care as a right in itself, a human right, not just a right that you have to earn your right to. I think that's more important to discuss than ever. So I think these two issues is what really comes to my mind, first of all.
Christoph?
Yeah, I have to say also I found the film quite moving, and that's partly because I am from pretty much the same generation as many of the people who star in the film, actually. So also the period that is portrayed in the movie from the 1980s to today is pretty much a period that covers my own professional life also. So you get to think, what have you been doing in those days? And obviously I've never contributed to anything like they did, but it brings me to think that something that is easily forgotten, overseen in the nitty-gritty and small detail of working on the technology of global health and medicine and academic work and whatever it may be, is the idea of social justice, which very much drives the protagonists of the film. And the film makes, I think, a very good point about that. you need this undercurrent, and you need it to be a strong undercurrent in your work.
Yeah. So I guess, I mean, one of the sort of clue line for me is with this film, which I also, it's made a huge impression on me, is what Jim Kim says towards the end. He says that optimism is a moral choice. And I think that's what they show off so nicely during this entire period. You know, it's a large, or it's a long period of time, and they start out, as Anna said, you know, in this very small. They haven't really started medical school yet, and then Paul Farmer meet this lost Ophelia, who is actually the daughter of Roald Dahl, the author, and they both start working together, and then from this very small enterprise, they sort of move their way around, and as Paul also says a place in the film, I think he says, you know, there are I choose to see not the problems but the solutions, and that's how they work. And I think that's such a, you know, they really show that along the way. And there's a lot of problems they do not show in this film as well, of course. So, but I mean, this it's incredibly motivating to see people struggle like that and really get things done in that way, which I find really impressive. So then we would like to open up. I mean, so here we have an infectious disease specialist, and we have a medical historian, and who has worked on this period of history, actually, both on the history of tuberculosis. And Anna Ma has her specialty in tuberculosis and HIV. I'm sure there are some questions for them or some comments on the film. Would you like to share? Are there other impressions? Do you have any questions? I think we take the young one first. So there's Emma first. Do we have a microphone for her?
So my question to you guys is, as a medical student, sometimes it can seem overwhelming when you see everything that's happening in the world. And especially as a young person, you hear all of the established beliefs. And then how do you fight against that? Where's the first step? And you guys, have you seen any movements, and what would be the things that you've seen in these movements that we could take forward in the problems facing the world today?
Well, first of all, I think medical students now are very educated, not in the sense of being medically educated, that will come along the way, but actually social media, everything makes people, young people, quite acknowledged. So I think you have the good basis for being that kind of person, but of course you also have this right personality and strong belief. I mean, when you look at these people in the film, as you said, they probably have a lot of hurdles and a lot of problems, but they kept on and doing what they believed. And especially related to the HIV story, which I started working with HIV in the mid-90s, but actually I was a medical student in Norway, taking care of AIDS patients. That was in late 90s, around 1990. And it's really true what they say in the film. It's a lot of stigma, a lot of people were frightened. People didn't dare to touch these people. So you just have to kind of, so many established beliefs. And if you have this belief in yourself, just go for that. It's not easy, but I think young people now are more prepared than actually this generation was in that sense.
And I would probably like to add that one has to have the guts to disagree. This is in many ways a story about dissent, and as a historian, if we go back to that situation where Paul Farmer and others started engaging multi-drug-resistant tuberculosis in the 1980s, one of the points they made is that everybody else was considering tuberculosis to be a disease almost of the past. It was old TB. It was something that was on the way out. And that was driving the system. So that's why everybody was just treating susceptible TB. And WHO would think that, established treatment and BCG vaccination is actually going to do the job. And one of the points that Paul Farmer and others made that no, disease is not tuberculosis is not an old disease. There's a new tuberculosis, and there's lots of drug-resistant tuberculosis. And if we don't find new solutions, which is giving advanced treatments to everybody, then we're not going to tackle this. And I think that's what the point of dissent was all about in saying that there is a new tuberculosis and we have to face it. That was their point of departure, I think.
And I also think, I mean, so the strong message, I think, also in this film for us, and particularly for you, is not to take things for granted. That you hear that everybody's, you know, are sure that experts are sure are right. Like, for instance, they do not know the watch. They do not know how to, you know, they do not know how to do it. It's not cost effective. It's not. So do not accept things that people seem to take for granted, and always ask questions. And I think, I mean, so Jim Kim and Paul Farmer, they were actually helped by studying social justice. So they did this parallel program in medical anthropology at the same time as studying medicine at medical school. They did a double degree program under this autoclimate that you see in the film as well. And they say that actually helped them, you know, putting these questions up on the table that was very contrary to the established thinking.
My name is Sverre Lie, and I'm a pediatrician, which has for the last 12 years been so privileged that I've been able to work in international health. And this film made a great impact on me, I must say, and I learned a lot. I think I know most of the medical stories and the therapies and the resistance and everything. But the political story, I think, was quite new to me, and the impact of the Partners of Health was much bigger than I thought before. And especially to see that this Kim is now the president of World Bank was for me absolutely new. I was in particular happy to see that Rwanda was given such a big place, because for me Rwanda is a miracle. And I think Rwanda proves one point, which I think was not too mentioned in the film, but it is the importance of leadership, of political top leadership in a country. And I think Rwanda is a wonderful example of that, with a wonderful president. He's a little authoritative, but he has a wonderful Agnes, which we saw a lot of, which has made a tremendous impact, and with the right focus on the need of universal health coverage. And that gives me a final comment that I think it should be mentioned in the film, although it was not the main point. But there is a remarkable political movement during the last 20 years, and that is the political, unanimous decision on fighting poverty, coming out of the UN General Council. The first was the Millennium Development Goals, which started at 2000, ended in 2015, and increased the public spending on global health from $3 billion to more than $30 billion. And that is a vast amount of money which went to many poor people. And this decision was unanimous. And in New York are the state leaders, not as in WHO where you have health ministers, but you have the state leaders responsible. And the one we have now, which is the Sustainable Development Goals, I think is equally important and was also unanimously voted in New York in September 2015. It was not really a topic for the movie, but I think it should be mentioned in this discussion that this is a great movement.
Yeah. Thank you. Would you like to comment on that?
I think you just have to comment on that, because you're so right about this political will. Because you see, for those of you who don't know it, from 2015, HIV treatment should be for all, regardless of where you live or if you're a poor or live in a wealthy country. And you see that now, the statistic from the WHO, that those countries with political will, they have increased the numbers of treated HIV patients and also TB patients, and decreased the mortality. But you see those countries not willing to do that political will, like we see in East Europe, we see in the former Soviet Union, we see the inverse numbers. We see that HIV, TB increases, resistance increases. So it all has to do with political will to implement the Millennium Goals and the 2030 goals.
Yeah, I think politics is very important. Even though when I think, I don't know how you've seen the film, but the film makes a very strong point for social justice and philanthropy. I mean, they have this donor friend, Mr. White, who's often in the picture and who contributes a lot, and it's probably to ask a lot of the film to put a tiny bit of a question mark and ask, is philanthropy actually enough? And do we need politics independently of that? And as I said, I like the film and the message, but there's kind of a point where I thought the film was not entirely accurate, and I think this is the right point to mention it. And the film goes on about patents, and it's obviously, I'm a historian. It's correct that TB medicines, everything that was needed in the 1980s, was actually off patent because tuberculosis was treated with an outdated pharmacopoeia. However, the second part, the HIV medicine, was not off patent when it was required by everyone. And so philanthropy was a good start to talk about access to that medicine for everybody in the late 1990s, but it was not enough. And I think we need a bit of context here that the film is not talking about, and that is actually there's political movements in those days, and the most significant one I would probably like to mention is the decision by the Brazilian government in 1996. So even a tiny bit before the events are as they are given to us in the film, and that decision was to grant access to ARV medicines to everybody who had HIV in Brazil, and to decide to breach patents and to start the production of generic medicines. That is an entirely political move, and I think that's a context we need to know because all billions don't help when you don't have a political commitment to ask questions about power and control, which breaking patents does.
I am looking for hands, just as you know, so put your hands up if you want to raise a question. But I wanted to, so Anema, you told me that you were at the UN, at the AIDS conference in 2000, that we saw pictures from here. So could you please tell us about that atmosphere? Or, I mean, how was it to be an infectious disease specialist at that conference at that time?
I was absolutely not a specialist at that time. I was quite early PhD student in 96, which is really just an accident that it was the same year as you got antiretrovirals. But that meant it was very, very exciting to go to these conferences, and especially the annual AIDS conference, where there's a lot of activism. And now, when there is universal access to everyone, although not everyone, of course, gets the medicine, it was a very special environment at that time because it was, like you saw in the movie, a lot of activism. There were patients coming there talking about their disease. We heard that next year the patients didn't live anymore. So it was in the late 90s, very, very special time. And of course, when the global funds came in 2001 and the PEPFAR in 2003, it was a bit different, but in the late 90s that made a lot of impression on me as a quite young PhD student working in the field. So that what you saw in the film was actually, I felt that it was that way. Yes.
So Christoph, I just thought, so while we're waiting for people out in the room to ask questions, could you please tell? I mean, the period we are seeing in this film is actually covering the history that you're studying, the history of global health. So could you please just maybe tell us, enlighten us about that transition phase from international to global health?
I mean, one thing that is in the background in the film, and that makes it easier for us to understand the film, is that in the situation where it starts in the 1980s. WHO is still a powerful institution. It pretty much rules the whole field that we today call international or global health. It goes into a deep crisis. It's not just that its battle against tuberculosis turns out to be insufficient because they're using outdated medicines. They're putting all their money on a vaccination that doesn't work quite as well as they think. Also, WHO goes bankrupt in the 1980s, and that's mostly because the Americans pulled the plug, Ronald Reagan, on that institution, so they stop contributing to WHO. And then a new world arises, which we all know, which is instead of one big institution that serves as a political platform where people discuss international health, we get this ocean of non-governmental organizations, NGOs, that we have today. And we get the global health, which is often driven by interventions into crises. So there's this epidemic or that epidemic, and we have to go there. We have to do something, and a lot more money actually goes into the field than had been there in the 1980s. But it is often a field that is driven by immediate crisis intervention, and it's quite myopic. So you don't build health systems. And against that background, and I think we all know some organizations who handle it that way, we can appreciate the significance of the contribution of partners in health to actually say, we're not just going for fighting epidemic A or dealing with health crisis B. Instead, we're working with the public sector, which is exactly the sector that had been destroyed so much in the 1980s. It's mentioned in the film. The structural adjustments, the World Bank pushing money-saving programs on all the countries in what we today call the Global South. So in many ways, Partners in Health is trying to amend for some of the problems have been created by early global health and by Reaganomics, let's put it in that word, in the 1980s, investing into health systems, building comprehensive structures like hospitals that can actually serve many purposes, rather than just waiting for an epidemic and then sending a few helicopters and with a vaccine. So I think that's maybe the significance here.
So Anne-Ma, is it something that you would like to? Would you like to? Maybe you could enlighten us somewhat. I mean, how is it today? I mean, is it? This is sort of it stops on an optimistic end in a way. But how is the situation with tuberculosis, HIV, now in the world?
Well, the film is like a kind of story that it seems like it goes from the one epidemic to the other. It seems that they got a solution on every one. I mean, that's of course not the case. It's still a lot of challenges with new infections like neglected tropical diseases, malaria, a lot of other diseases, but also HIV or TB. I mean, we have 36 million people living with HIV, and we have almost 2 million deaths still. We have 1 million newly infected. We have 1 million deaths of TB annually, and 40% of these are co-infected with HIV. And we have parts of the world where you don't have the 50-60% coverage of antiretrovirals, like I said, in the former Soviet Union and some parts of Asia. So there's still a lot of challenges and problems. And actually, I have a bit also a question to you, actually, when it comes to the financial gap, because after the financial crisis, all the global funds seem to be empty, and Dr. Without Borders, they have really emphasis on what we do now, and because we have the NGOs, we also ask the governments to commit more, but we have financial problems as far as I see. I don't know if you will comment on this.
I hadn't intended to comment, but I'll gladly do it. I mean, what we, I work as a historian, but if what I know about the immediate past is that actually if you look at how funding for global health has developed over the last 10 to 15 years, then it's probably flat and maybe even going down. So I'm not sure about the sustainability of global health itself actually in the near future.
So we have a question down there.
Yeah. My name is Dag Hareide. In the beginning of the film, this was this vision: we should bring healthcare to the whole world and start with the poor. And now in a follow-up to you, what you said, and there was another sentence there, because there is a lot of money in health, especially where people are healthy. There is a lot of people educated in health, but where people are sicker, it's not so much. And when it comes to technology, there was a sentence from Paul. He said, when you talk about appropriate technology, it means shit for the poor and good for the rich. There is a lot of money into health technology now. So I want you to comment on that. How does that come out and who controls it?
I don't think I can answer to all of that, but just an example. I was quite recently in India at a TB conference, and then we got opportunity to go into the slum to see a DOTS clinic where they treat TB patients. And then you see the poorest of the poor people at the same time as you see computer technology, where you have the iPad platform, how you can actually you can follow the patients and see how they adhere to treatment, if they have symptoms, and then you can community workers that's not have the medical education could quite easily then use this nice application to diagnose the patient and send all the data to a clinic. So I don't know if I answer your question, but I think we are now in a time where we can use technology actually also for the poor and make it so easy that we can actually engage not medical and community people. And that was what was done in this slum. There were no medicals there were community people. And this was also NGOs. So that's one example. But
on the other hand, we treat too many people, we diagnose too many people, we use too much technology on people in the West. And, so one of the ideas they had in Partners in Health very early was they took from liberation theology, the South American version of theology, which sort of combined socioeconomic Marxism with theology, and they had, the expression they took was preferential option for the poor. So I think, that has sort of been their banner. So if we could, use technology and within this banner of preferential option for the poor, I think technology could be used for many good things. But what also this film shows so beautiful is that you need humans to give medication and also provide, treatment is not enough. They need schooling and food and care and water to be able to take their medicines. So
it's a very important question. In a sense, there is problems in whichever direction you go, because the policies that were practiced before Partners in Health and all that came along was WHO had prioritized what they called affordable technology. So that's what Paul very much despises. The advantage with this is, of course, it was indeed affordable. So even a poor country could, for example, run a health system based on that type of technology. Just to give an example from my work, in the early 1980s, the country Tanzania could still cover about 2/3 of the costs of its own national tuberculosis program. So what happens when you bring in access to high-tech healthcare? It's very beneficial for the patients, and we see that here in the film. There is a problem here that it might increase dependency on donors. And that is a dimension into which the film doesn't go into very much. The film basically blesses the donors. The donors are shown as people who do good. And that's certainly what they do. I'm not questioning that. But we'll have to be aware when we look at this as a political phenomenon that a country that practices a medicine that is a lot more expensive without actually expanding its economy to a noticeable degree runs a danger of being dependent on permanent influx of donor money. And that is something we have seen in global health in the last 15 years, that with the application of high-tech medicine, dependency on donors increases. And that brings me to my conclusion in answering your question, and that is the model of Partners in Health is very intriguing. A question that we have to ask, and to which I don't have an answer because I'm a historian, is can it be, to which degree can we expand that? because Partners in Health is based on the ability to channel donor money from one place to another. So there's probably limits to how much you can expand that, because there's no unlimited amount of donor money around. There is a certain a buffer in this, and that is that the cost of even high-tech healthcare has been lowered a lot in the last 15 to 20 years, and that's because the pharmaceutical industry has grown in the global south. So in the days when the film starts, all the medicine comes from the north. It's Europe, America, Japan that produce medicine in the 1980s. So it's a north-south trade, and the medicine is very expensive. Today, I've just been to Africa for several weeks working on the history of tuberculosis, and when I ask people, so where do your drugs come from? Well, they come from India.
I think we should... So we need to make room for 2 more questions before we stop. Yeah, please. You need a microphone.
And a microphone?
Microphone.
But you need a microphone. We want you to have a microphone.
I'm Michael, I'm a PhD student with research focus on mental health. And the film that we just saw portrayed the reality of the challenges that we have in Africa and then possibly elsewhere. I've had an opportunity to come in contact with these Ebola patients in 2014 in Sierra Leone, Guinea, and then Liberia. But I come from Ghana. The challenge that I saw was that people don't even know the kind of disease that sometimes they are affected with. They only hear the name, but to prevent themselves is a problem. Sometimes to travel to some of these villages is a problem. There are no roads. And then where there are roads, you go and then maybe you get a flat tire with your car, or you get a problem, your fuel will get finished. You need to get out of the car to walk with your drugs at your back before you get to the destination. So those people that we saw, the doctors who were traveling and all that, I think that the reality, that some other challenges that they face were not portrayed or were not shown in the movie. So if maybe we are to go elsewhere in the future, we should expect a much more challenges than what possibly we saw in the movie.
Yeah.
I think you're totally right, and that might be under was said so well in the movie, that you have all these logistic and resource challenges, and many of these diseases are actually linked very much to poverty, and you might have also access to drugs, but you don't have the stability of life, or you're more concerned about your bringing food on the table than actually to be treated. So it's I think especially TB, but also HIV is also, and a lot of other diseases are diseases of the poor. And I know that in the audience there are people, also more people here with experience from Ebola works that would agree with you. So
yeah.
But just for the film, I know that, for instance, to travel to Kanj, you had to cross a bridge that was, completely non-transportable half of the year. So just to support your point, there was a lot of different, and that lasted for 10 years, and they didn't get there simply.
And I would agree to what you say, and I think the film actually makes a similar point when it mentions that the lack of health systems in the countries that the film talks about is not something that kind of fell from the skies, but is to a certain extent a result of policies of the 1980s that went out to destroy whatever there was in the way of health systems.
So now we have 2 last questions, and then if there's, I think we'd say that these are the last one, and we do them in, so we take both of them, and then we can end.
My name is Christina, and I'm nobody, but I still wonder, when there is so much natural remedies in the nature and stuff, why don't we see more into that and why Norwegian pharmaceutical health industry have a sovereign domain to call something medicine, and why it's not allowed to advertise for natural healing remedies instead.
As for instance,
Oh, as for instance, as promoting garlic and tea tree oil, and to see more into the natural stuff the nature has to offer, and that it doesn't have to cost very much.
so we take the next question and then we can round up. Thank you.
My name is Christian Prevenson. I'm a doctor interested in infectious diseases. I was wondering if you could just comment, because the film sort of ended with Ebola, and there was quite a lot of criticism about it. Sort of showed the response in Rwanda, which is sort of you might say, a sunshine story. It worked very well. They had already had a good health system in place, but there was a lot of criticism that the global response to Ebola only got started when people started arriving in the West with Ebola, and the United States and Europe became worried that the epidemic was going to spread there. So I just wondered if you had any comments from your various fields to that, sort of about that. Yeah, thank you.
I just very briefly comment on that, because I agree with you, and we are aware of this, that it was quite delayed. So I think I will pass it over to you. If there are any in the work WHO and from a historic point of view are working or organized that could kind of explain the delay in response. Is it bureaucracy, or I think I will pass the question over to...
Yeah. I mean, I think that there was a bit of surprise, or people seemed surprised when Ebola was debated, that why has the response been so late? And much of that criticism was directed against WHO. Well, historically seen, WHO is always late. But I would not blame that on WHO, because WHO is a political institution. It works like it's a platform where states meet to discuss common interest and probably act upon problems they have in common. And that means to just take one step. WHO is reliant on its member states agreeing to take some action and actually putting some money on the table. So there was a slow response to Ebola, but as it's been widely made to blame that response actually on WHO being slow, I think is a misunderstanding of the political nature of WHO. There could be other institutions who could act swiftly, but I very much doubt that WHO will ever be one of those, because it works like a parliament. It's a political process. It's for the slow and long grinding of problems rather than for their immediate solution. I have a comment to your question, and as you have understood by now, I'm not a clinician, so I have to leave the question aside, which medicine works here and now. But as a medical historian, I know something about which medicine has worked in the past. And the distinction between natural medicine and biomedical stuff is a bit artificial, because much of the biomedical medicine is actually quite natural, like antibiotics produced from fungi and all that. History is a very empirical science, and we can see which technology actually makes an impact on diseases and which we don't really see when we look at the evidence. And then the case for natural medicine is not a good one, by and large. While, for example, this is not relevant in relation to our story, but vaccines are unbeatable. Sadly, we don't have We don't have an HIV vaccine yet, but if we would have one, we would see that impact. It's the only piece of medical technology where you can see the impact in population statistics is vaccines. I know of no other technology that does it, and no other type of healthcare that can deliver such an impact.
I think I just conclude by being very much agree with you that much of the drugs that we use in modern medicine, Western medicine, is actually derived from nature. But regardless of what kind of medicine, you have to go through the same trials, the same testing to be able to approve drugs, because also Westernized drugs or more modern medicine drugs have gone through several tests and trials before they are approved. And I think as long as alternative medicine can also do the same thing, this is a discussion in its own. I don't think we should go into that, but I think it should be the same rules. And of course, whether many drugs will come from nature, and if they're tested to be proven to be safe and work, of course we could use them. But they have to be tested. And also, and I totally agree that for many epidemics, vaccines is really what's going to solve a lot of the problems.
I'm just commenting. We have to stop it. I just wanted to comment on your question about WHO, because I think it's also a fact that we have seen in international global health lately a securitization of global health politics, which is a problem, I think, because it's very much focused on what can, be a danger to us. We focus work on what can be based on our priorities and not on theirs, which is or the people who are suffering. And again, I mean, bringing up this, preferential option for the poor should be something we should take home from this film. But then I wanted to, do you have something very brief towards the end, or is it okay for you that we stop now? Because I think we should. Yeah? I just wanted to tell you that I saw Jim Kim speak about this film, and he had this really, really important comment, I think, that was, when we look back on the 1990s, when we debated access to antiretroviral drugs and drugs against resistant tuberculosis. We met these arguments that seem so horrible to us now, that, they don't have watches, they don't have a culture to take medicines, they're too poor to be able to do anything. This is so horrible for us now, and so obviously horrible. And then his question to us was that, don't look at this as horrible. Try to look at our contemporary time and see what will people in 20 years think is so horrible about what we do and think and feel today. And I think that was a very good, thing to bring for us all out of this room, and try to think, what will people in 20 years think of what we do and the things we practice now. So thank you so much for coming and listening to us.